Good afternoon, Doc. Today I'm going to present to you my video presentation of taking the blood pressure. But before anything else, we have to ensure that our equipment is intact and functioning properly. This is for us to get an accurate result and to avoid delays. Next would be, it is also important to have a thorough hand washing before and after every procedure sa imuhang patient. And next also is to introduce yourself and identify your client's identity. So let's start. So, good afternoon, ma'am. How was your day? Okay, so by the way, I am Mary May Rodeo. I am a medical student at Southwestern University, FIDMA, and I will be taking your blood pressure, ma'am. So, kani siya par, rapod mabala na to if normal ra ba ang imong blood pressure or say kuan na batay mga taas ba or mubo lang. So, is it okay nga natay video, ma'am, for rhetoric demonstration purposes only? Okay, so I will let you sign an informed consent stating that you agree and understand sa atong video and of course with the procedure as well. Okay, so thank you. So now that we have obtained an informed consent, we will proceed by asking the client if she has drink coffee or if ang client is smoke ba 30 minutes prior to coming sa ato ang consultation or sa BP taking. So as we all know that smoking can constrict the blood vessels, and of course the caffeine can elevate our pulse rate. So both of these can give us a false elevated blood pressure. So it is very important nga ma-assess na to if nag-inom ba og coffee ang atong patient. So nakainom ta og coffee before coming here, ma'am? Okay, so since wala man nag-inom ang atong patient, then let us now proceed with positioning the client appropriately. So if the client is ambulatory, like our client today, then we have to make sure that both of her feet is flat on the floor. Because if it is crossed, then it will give us a result of an elevated systolic and diastolic blood pressure. So let us begin. So we should also ensure that the elbow is slightly flexed with the palm facing up and the forearm supported at the heart level. So it is very important na heart level siya, because if the forearm is above the heart level, then it will give us a decreased blood pressure. And if it is below the heart level, then it will give us a decreased blood pressure. So at the heart level, and let's start by wrapping the forearm with our cuff. So we should ensure that the cuff is not too tight or too loose. Okay, again, it will give us an inaccurate result. And we should also ensure that the cuff is 2.5 centimeter or 1 inch above the antecubital fossa. So let us now begin by palpating the radial artery so that we can do our initial palpatory determination of systolic pressure. So this initial palpatory method will tell us the maximal pressure to which the manometer needs to be elevated in subsequent determinations. So it will also prevent underestimation of the systolic pressure or overestimation of the diastolic pressure if an auscultatory gap occurs. So we will palpate the brachial artery with the fingertips. So these fingertips, we dili ni siya kani ang thumb, but this one. So, okay. So now that we have located her brachial artery pulse, let's begin by pumping up the cuff. So we will pump the cuff until we will no longer feel the brachial pulse. So we can also use the brachial pulse site or even the radial pulse site. So this time we will use the brachial pulse site. Okay, so we will pump up until we will no longer feel the pulse. So the pulse stopped at 100 mmHg. So this is very important to note where the pulse is not felt, because this will give us an estimation of the systolic pressure. So we also release the cuff, and we will wait for 1 to 2 minutes before making further measurements. So this waiting period will give the blood drop in the veins time to be released. Otherwise, false high systolic readings will occur. So we will now get the blood pressure using the auscultatory method. So before going with our stethoscope, it is very important to cleanse the earpiece with antiseptic wipe. So para nagugaw ba siya. So it is very important na before niyo siya gamiton, then kinahanglan siyang na-wipe. So na-wipe na niya siya ganina. So we will insert the earpiece of the stethoscope in the ears, that dapat siya slightly forward, because sounds are heard more clearly when the ear attachment follow the direction of the ear canal. So if dili siya slightly forward, then dili kay nato madungog ang sound. Next, we should also ensure that the stethoscope hangs freely from the ears to the diaphragm, because if the stethoscope rubs against each other or any rubber, then it can block the sounds in our stethoscope. So we will use the bell side of the stethoscope, because as we all know, the blood pressure is a low frequency sound, and it is best heard in the bell-shaped diaphragm. It is also important to note that we should put the stethoscope directly on the skin and not on clothing over the side, because it can give a noise made from the rubbing of the stethoscope and the cloth. So we also need to pump the cuff until the sphygmomanometer is 30 above the point where the brachial pulse disappears. So ganina, while doing the palpation method, nag-stop ang atong brachial pulse until 100 mmHg. So we will add 30 mmHg on it. So we will pump up the cuff until 130 mmHg. And again, we have to release it slowly. Kay if ang pag-release is slow or fast siya, it will give an error in measurement. You should also ensure na dapat ang this one is at your eye level, so that maklaro gyud nimo ang numbers. At 130. And release slowly. Okay. So after releasing, so ang blood pressure of the client is 100/80 mmHg. So normal na siya with her age, because our client is 34 years old. So 100/80 mmHg. So if ever nga ang client has increased or elevated blood pressure, we need to do it again, the procedure, to confirm if sakto bang atong reading. We will do it again, the whole procedure. So, but before doing it, we should wait for 1 to 2 minutes before mag-BPO. So with our case, the client is 34 years old and 100/80 ang iyang blood pressure. So it is normal. So we don't need to repeat the procedure again. So kuan ma'am, okay ra ang iyong blood pressure. So kinahanglan ra nato siyang i-maintain, and of course mulasan ra ta sa atong salt intake, and of course sa mga fatty foods. And we also need to exercise, biskan walking lang every day, and important sad ang pag-rest early. So okay ra imong baby ma'am. So thank you so much for participating sa akong video. So that ends my video presentation, and thank